Today, 24th March 2021, marks the World Tuberculosis Day, a day where the whole world commits effort to community outreach in various countries. Nigeria, having commemorated the launch of the Chekamo slogan, visited the Lugbe community of the FCT to drive home the free testing and advocacy of the Nigerian people on the danger, control and care for tuberculosis. This singular act to prove that the Buhari administration, through the Ministry of Health, in collaboration with partners, is deliberate in the fight against tuberculosis. We will recall that Nigeria ranked first in Africa and overall sixth in the list that constitute the country with a high bonded index of tuberculosis. We hope this exercise will not end today for us to eradicate the tuberculosis surge.
We are all aware of the devastation that the COVID-19 has brought to all the world, including Nigeria. And the health sector was not spared. In particular, TV program was worst hit. Why? Because attention had been diverted from other diseases and concentration was made more on the COVID-19. So this year World TB Day, which is tagged, the theme is tagged, the clock is ticking. And our slogan says, that cough, if it be tuberculosis and not COVID-19.
We have come to tell every person about signs and symptoms of tuberculosis, because it is important to know what do I do when I'm feeling certain things that is different. Any cough is career. Any cough, any career that is more than 2 weeks, up to 2 weeks in order. Any cough that is starting you is a suspect of tuberculosis.
My name is His Royal Highness Alhaji Dr. Usman Gakupi, the Safa of Garki in Abuja.
Okay, sir, so tell us how you feel with this outreach today.
Well, I want to start by thanking God, thanking the Minister of Health, especially the National Tuberculosis, by bringing this program to Lugbe community, whereby we have been sensitized, enlightened, and awareness have been given to us about the tuberculosis, the symptoms, and how we can prevent it. And I want to use this forum to draw the attention of the entire nation to come out in mass to have a check, the test, because health is wealth. So you don't need to wait, especially when you have cough for more than 2 weeks. You need to go to any medical health center for a checkup, because if you hide yourself, the tuberculosis will also hide you. And after all, we have been told tuberculosis is not death sentence. It is preventable and it is curable. So as soon as you get any symptom, please don't hesitate go for checkup and take your treatment.
Okay, sir, so have you had this kind of outreach before, or this is the first time you're having this?
Well, actually, this is the first time we're experiencing is my chiefdom. Though at times they normally come to exercise us in our various palaces, but gathering people outside like this is the first time. So we appreciate the government.
I'm a director and head of advocacy, communication and social mobilization at the National Tuberculosis and Leprosy Control Program, Federal Ministry of Health. We all know that awareness creation is key. Information is key in any project, in any program. And currently, the awareness on tuberculosis in Nigeria is quite low. And so one of the essence of coming here is to actually create awareness within the Lugbe community. And we've been here since morning. We are happy at the turnout of the meeting. Even you guys, the media people that came, the information that had been given to the people is also key. So we're here to sensitize the people and also to let them know that we still have tuberculosis in the community, existing in our community. Because out of the number of TB cases that we are supposed to find in Nigeria, we have, as recommended by WHO, we've only been able to find 1/3 of it. We mean we still have 2/3 of people, suspects or presumptives, people who are likely to have tuberculosis still living in our community. And so we chose Lugbe community here in FCT to come and create awareness, to let them know that TB still exists among us and that TB is not a death sentence. TB is like any other disease that should be owned by people. People should be able to own up that they have tuberculosis. We also know that the diagnosis or the testing for TB in Nigeria is free. Treatment is also free. And so we've come to let them know that in the health facilities, they can go and access these services free of charge. Because we've also been able to get a toll-free number. When we carried out a research in 2018 with the 11-digit number that was given as a toll-free, we realized that many people could not remember it, and so they did not call. So we were able to get the short code from the NCC, which is the 3340. And so we have also come to let the people know that we now have a shorter number, which is toll-free, that they can actually call to get information on tuberculosis and where they can actually access the services that are available. Me personally, as the head of advocacy and communication and social mobilization at the program, I want a situation where the message on tuberculosis is on every day after. It's an everyday affair. That's the media giving the visibility, and so going forward, we will make every effort as much as we can, not waiting till the next 2022 World TB Day. We should be able to have a continuous engagement with the media, be it either through virtual or even face-to-face. And that is the new thinking that we have. I know prior to now, we've always been waiting till the next year's next day World TB Day. And I want to say that this year World TB Day theme says the clock is ticking. And the clock is ticking is apt as of now. Because, like I said, we have so many cases of tuberculosis in the community yet to be identified or yet to be notified. And yet the goal that was given to us, 2023, is at the corner. We've not gone anywhere. So the more we create awareness, the more we give the right information to people, the more the people will be able to take decision, an informed decision on their health issues.
You go to any health facility, government facility, or even the private health hospitals to look for help, and they will check you and then see whether you have tuberculosis or not. Or you call 3340 for information on how to get help on tuberculosis.
And today being the World Tuberculosis Day, what is your recommendation to the government and to the citizens as well?
Yeah. Well, my advice to the government is that we need to improve on our service delivery, increase our service delivery points, get more equipment to test for tuberculosis, and also the government is doing a lot currently because we have increased quite a lot over the years. And also even also there are new testing machines that are in country currently. So they're doing a lot, but a lot still needs to be done in the area of providing more funds and then more people, workers, to work on this field in the healthcare system to strengthen our healthcare system. I think if we have a good and strengthened healthcare system, we'll have a better disease control.
Gilbert Damaji, Voicetv Nigeria.